Welcome to Medica Nova Wellness Studio. I'm Dr. Angelika Maria Koch with the educational videos about optimal health and the most innovative and holistic approach to your well-being. In today's video, let's explore how you can manage and heal Crohn's disease with natural and effective therapeutic tools. In the US here, it's estimated that 1.5 million people suffer from inflammatory bowel disease, whether it's in the form of Crohn's disease or ulcerative colitis. Crohn's disease is a type of inflammatory bowel disease, and it's often experienced with severe abdominal pain, excess diarrhea, malnutrition, weight loss, fatigue, and the list goes on. It's a disease which really affects the quality of your life. And in this video, I will give you great tips how to meet this challenging situation with ease. So stay tuned and enjoy this video. To stay updated with more ongoing videos, I encourage you to subscribe to my channel, share and like it with your friends and families, and don't forget to click that bell as it notifies you every time I upload a new video. Thank you so much for your thumbs ups and your likes. I know I've been away for the last few weeks. The reason was that here at Medica Nova we implemented fantastic learning management system on the Medica Nova Online Academy, so students can now really have access to this curriculum in a much more concise and also fun way. If you're interested in learning about homeopathy, mental health, health and wellness coaching, quantum healing, and so much more, look at the website medicanova.net at the Online Academy, where you will find comprehensive certified home study online courses. If you want more guidelines and information, contact me at health@medicanova.net. So what is Crohn's disease? As I said, it's a chronic inflammatory bowel disease that causes inflammation of the gastrointestinal tract. It is one of the two conditions included under inflammatory bowel disease, and I mentioned ulcerative colitis. To be honest, in my experience, it's just Crohn's disease is a level higher in intensities, but they work with the same symptomatology. It can affect any part of the digestive system, starting from the mouth to the anus. So in the initial stages of your developing Crohn's disease, diagnosis may be a little bit difficult. The disease primarily causes ulceration of the small and the large intestine. Experts now believe that there's a combination involved of genetic factors, chronic stress, and I want to talk about this more in this video, an inflammatory diet, maybe exposure to certain viruses and infections recently, along with several other risk factors that are maybe to blame for the majority of inflammatory bowel cases. But research also informs us that there may be a fungal proliferation involved, so there may be yeast or candida in your whole system, which affects that. But suffering, from Crohn's disease, as I said, truly affects the quality of your life, and you want to tackle that with the right treatment protocols. Today there is a lot of hope for, we call it the IBD sufferers, and that can be in the form of holistic medicine, lifestyle changes, dietary intervention, maybe stress-reducing techniques as well. And many people battling Crohn's disease and colitis are able today effectively manage maybe flare-ups by eliminating, in this case, highly inflammatory foods, maybe gases producing vegetables like broccoli or cauliflower or kale. We talk about this more, or learning how to manage, right, your stress response, paying attention and monitoring your biofeedback. So what are your triggers? What gets you going in these flare-ups? Or in supplementing, of course, with beneficial natural supplements like probiotics, enzymes, because by then your body is lacking enzymes to break down the food. You can't assimilate it very well. That's why it leads to malnutrition, as well as herbal formulas, minerals, and of course homeopathic remedies, which individualize the treatment protocol overall. So let's talk about the different types of Crohn's disease. The first one is more the simple one, the mild one. It's the inflammatory stage, and that causes sort of simple erosions or little fissures or tears in the bowel walls. The second one is way more chronic, and it leads to formation of scar tissue within the walls of the bowels. And as the inflammation maybe heals by the body, we still have now the scar tissues, and that leads to obstructive symptoms, and therefore sort of like the bowels can't move very well and poorly. The third type is now really asking for medical attention. By then you probably have surgery, and it's more of a penetrating disease in nature, meaning under which the inflammation travels now through the bowel walls and forms connection with adjacent organs. And that means, you maybe have a fistula, we call it, from the colon to the bladder or anus, and that can be very difficult. But most common areas affected by Crohn's disease are the last part of the small intestine. We call it the ileum, or the large part of the colon. Crohn's disease symptoms can range from mild to severe depending on your individual story as well, and how much the tissue has deteriorated and is inflamed. Symptoms usually develop gradually, but the flare-ups can come without warning. So let's talk about the symptoms. And I want you to put attention onto your individual symptomatology, because then later on I share with you specific medications, homeopathic remedies, which deal with the specific symptoms. Most of the patients experience extreme diarrhea, and we talk about 4 to 6 bowel movements a day, and that can be a problem. Let's say you have a job, or you're in a position which asks you to travel a lot, right? You be on the trains, you be on a flight, and by then it becomes an anxiety situation, because you don't know where the next bathroom is. You don't know if you can hold it. I mean, we have to be blunt here. It's like really, really difficult. Now, also when you have so much diarrhea, you lose a lot of fluids, and that can lead to dehydration and affect your electrolytes within your body, the balance. We talked about intestinal cramping, abdominal pain up to the sky. I mean, I've seen patients rolling on the floor, doubling over. The muscles within the intestinal walls are prone then to spasms because of the inflammation. Now, your intestinal walls, we have longitudinal muscles and round muscles, and usually there's a nice rhythm going on, and the food is propelled along your colon to the anus, and eventually you eliminate it. Well, this peristalsis is absolutely interrupted, and you have obstructions and blockages in your colon. With it can be nausea and vomiting, maybe even in acute situations, fever and fatigue. We talked about the malnutrition, because by now the enzymes are missing for the catalyst to break down the food and to assimilate it well. You also maybe see blood in your stool, and then it leads to anemia, because now we have a lack of iron. So it's a domino effect, one leads to the next. If you see or you have a tendency for mouth ulcers and cold sores, or cold sores not so much, but maybe mouth ulcers within the lining of your mouth, it's definitely related to your digestive tract and can be directly linked to Crohn's disease. Of course, with so much abdominal pain and excess diarrhea, you have reduced appetite and therefore weight loss. And that doesn't help either, right? Because you're just getting worse rather than better. Others experience a perianal disease. That means you might have pain or drainage near or around the anus due to the inflammatory part from a tunnel into the skin. I talked about that. Fistulas cause abnormal connections between different organs and sometimes cause food particles to make their way to the colon before they normally actually should, and then it becomes a really alarming situation. You see anal fissures. As I said, I talked about anemia because of the blood in the stools, but also there's a direct link to joints and your tendons, so you maybe exacerbate the tendency for arthritis. There is definitely enough research today there where we see chronic inflammations in the intestines can trigger the body's immune system to start inflammatory processes which affect the joints and the tendons, and then maybe osteoporosis comes in here as well, and the list goes on. But if you see strange things happening like skin tags, for example, around the anus maybe, skin rashes, your liver is affected, you suddenly have gallstones, your kidneys are affected, right? Your joints are aching. Eventually it leads to bowel cancer, but that's not what we talk about here, right? In this video, you want to have it simple and easy and just help you over the mild, moderate stages. But believe it or not, Crohn's disease can appear in children as well, and that's very sad actually, because as they are still developing, it can affect the growth as well as maybe sexual development. So make sure you get the signs right at the beginning. This is due to the immune system dysfunction and then the inability to absorb a normal amount of vital nutrients. Blood loss, of course, and fluid are other symptoms that can cause the complications in children with Crohn's. So what are the risk factors and the causes? You know, you most see it more with a younger population, sort of patients below 30, maybe because of the stress level is so high right now. Ethnicity, I would like to mention that too. People in Eastern European descent, they are more prone to it. Diet, big time, 3 times underlined here. If you consume, food, highly spiced food, fried food, processed food, too much dairy products, sugar has to go, artificial and maybe artificial sweeteners, food with too much preservative, excess alcohol and caffeine, all of that is a huge trigger here. In general, medication, there are studies that, for example, oral contraceptives also have or are associated with Crohn's disease, antibiotics in general, anything which affects the bowel flora within your digestive tract over a period of time. I talked about exposure to viral infections or infections in general. So I put out something, you can hold me on to it, but because we just went through a long pandemic, I do suspect or maybe anticipate that there will be more cases with digestive problems on the coming out on the forefront. Once you have that, then it's also a direct link to autoimmune diseases because of this high inflammatory situation. Stress in our challenging and crazy world right now, very much associated with Crohn's disease. There's no doubt that stress can make symptoms worse and even can trigger the flare-ups. Family history. So if you have a parent, a sibling, or someone close to you in your family who also has experienced Crohn's disease, there may be a gene involved of this disease called NOD2, and it's identified in the recent years and is more commonly found in people with Crohn's disease in families that have a history of the disease. Smoking, of course, not just affects your digestive system, but also your cardiovascular system, and also where you live. It's research has, sort of informed us that urban areas or industrialized countries, we see more cases of inflammatory bowel disease situations, and this suggests that environmental factors like toxicity, but also their access to high fatty foods or refined foods could be a trigger here as well. Let's go for the second part of this video. It's called Food for Thought, Metaphysical Meaning. And with all of my videos, I often stress that, it's not just the physical expression. Look at your mental, emotional makeup. Let's look at your life. What's bothering you? Because it's a chronic disease, it must be there for some time. It's not something which comes and goes and you let it go. No, it's something which fundamentally really affects your whole demeanor, your behavior, your relationship towards yourself. And in Crohn's disease, there's a direct relationship with deep, dark thoughts and suppression of your feelings. A lot to do with self-confidence, self-esteem, feeling inferior, making yourself inferior. So I always refer to Jacques Martel references. He's very good on that. And he feels like it can be a form of punishment or self-punishment following a feeling of intense guilt. And I see this very much in my Crohn's patients. There are dark thoughts of anger and despair. I want to prevent my children from becoming autonomous, maybe, and I do everything I can do for that. So, sorry, but maybe you're smothering too much your children. Maybe you can't let go of your children. It involves my self-esteem. I feel not up to stuff, not good, not okay, a good for nothing. I depreciate myself so much that I come to think that nobody loves me and that people want me to feel inferior. I reach the point of stooping low. You see, the energy is very low, very dark, and it's not just from the outside, but you make yourself very low as well. And these feelings will add themselves to a situation where I feel deprived materially or affectively. Now I feel that the object of this deprivation was stolen from me in a very despicable or disgusting manner. So there's a lot of insult inside you as well, or feeling like you were insulted. To this may be added the fear of dying. There's a revolt will then be inside of me, a feeling of war, right? You have heightened emotions. We have excess diarrhea, excess abdominal pain. Everything is sort of up. The intensity is heightened. Throughout my whole body, I sense a feeling of hate that weighs heavily and that I may refuse to see. So this only increases my fear of being rejected by others. As I find it difficult to integrate myself into a group, I stay silently in my corner with my worries, and I feel like maybe a king or a queen in my castle, and I cling to my crown. And that's where the manipulative aspect comes in as well, right? We have the crown, where you hide behind. There may be a mask, there may be an image idea, and you want to look at this as well. I want to please others, to give myself some power and hide my helplessness. I'm always on a war footing, and that's this nature of, or the sensation of Crohn's disease. I can't accept how nasty my family was with me, and it makes me want to heave, excess vomiting, nausea. See, there's a direct relationship between the mind, body, and soul connection. As I have the impression that I'm nothing, this disease may help me to receive the attention I need and that I don't feel I'm getting. So the self-esteem is low, and I'm energetically maybe also too open, right? I'm like a sponge. I feel everything around me, including what is negative in my entourage or your friends around you, and that can affect you. I reject myself so much that in terms of energy, it is as if my stomach has become a trash can, and I'm allowing the people in my entourage to dump their negative energy into me. That's not what you want to live in life, right? You want to be aligned, you want to feel you are empowered, you want to feel that you are in control to some extent, right? Of course, life changes and we have to learn to adapt, because that's really what health is about. But if you feel powerless and out of alignment, we need to do something about it. So I let myself be dumped because I don't take my place enough, and I reject situation which makes me experience diarrhea, right? Loose. It's like it's all flowing out of you. I'm deeply in search of my personal or spiritual identity, and the seriousness of the disease tells me how far it involves an aspect of my life, and that is fundamental and essential. Crohn's disease is a serious disease, and it needs serious attention. So what will be the positive affirmation? Well, you can guess already. It's about accepting what's going on with you without judging, without blaming yourself, that you even feel low, that you even have a low self-esteem. But start with, how can I increase my self-esteem, and enable yourself to truly find your identity, and also this feeling of a rightful place within your family structure and society. It will help me find more calm and harmony in my life. The fact that truly finding my right place will provide me with a natural protection also from your environment, so you don't have to feel so sponge-like and that you take everything on, and thus discover also the security of I am, right? I stand fully in this life with this feeling of I am. And therefore also you experience much life more beautiful, and you have the right to exist. So go for it, right? This is the place right now. Let's go on to the natural treatment plan. Let's put our hands into the dirt and let's see what remedies I can share with you so you can heal much easier. As I said, we can do a lot today, but it involves a little bit of a combo with lifestyle changes, dietary intervention, natural supplements, homeopathic remedies. The first one you want to look at is your diet, and in the beginning you have to eliminate quite a lot to see also what are your triggers. You want to start with sugar, eliminate sugar, definitely grains and wheat products if you are sensitive or allergic to gluten reaction, which is often the case. You want to reduce all intake of all processed or packaged food, eating more prebiotic and probiotic foods, avoiding caffeine and alcohol, because it just sort of it just aggravates the whole digestive system at this point too much. I'm not saying you cannot eat it or drink it later on, but not in the beginning, in the healing stages. You also want to monitor your symptoms and your biofeedback. Get yourself a journal or have an app on your phone where you notify and list what are the triggers, what sets you up here. And believe it or not, some people even who were consuming high amounts of fiber or followed the FODMAP actually worsened their symptoms in a way. So that could be one of it. Or pay attention which types of fruits or veggies aggravate you. In the beginning, you also want to avoid raw fruits or raw vegetables, maybe steam them lightly or slightly cook them. That would be much better. Avoid all gases forming or cruciferous veggies like broccoli or cauliflower or kale. That's not so good. Drink a lot of fluid, really, because you have already diarrhea, you maybe already have blood in your stool, you may be already vomiting excessively, so you're dehydrated, and bring in a lot, at least 8 ounces of water a day.